Of all medications that work on the renin-angiotensin-aldosterone system, RAS, we will start with the ACE inhibitors. After this lecture, I wish to achieve the following objectives. An angiotensin-converting enzyme inhibitor, or ACE inhibitor, works directly on the renin-angiotensin-aldosterone system, RAS. Resulting from this cascade, blood pressure is dropped, and the workload for the heart is also reduced. Therapeutically, ACE inhibitors belong to the antihypertensive category. African Americans do not seem to respond to ACE inhibitors as well as non-Black patients. When using ACE inhibitors for treating hypertension, diuretics are commonly prescribed together for African American patients. Medications in this family have the same ending name, Priol. Here's a cheating way for me to recognize the ACE inhibitors. April. April. ACE inhibitor ends with Priol. Under normal circumstances, liver produces and releases angiotensinogen, which travels in the blood and transforms into angiotensin 1. Angiotensin 1 converts to angiotensin 2 under the catalysis by angiotensin converting enzyme, ACE. Angiotensin 2 is a much stronger vasoconstrictor. In addition to causing vasoconstriction, it also stimulates the sequence of adrenal-renal responses. The result is increasing blood pressure as well as increasing preload and afterload. ACE inhibitors work directly on the process of conversion between angiotensin 1 and angiotensin 2. It stops the series of vasoconstriction and retention of sodium and water. In addition to angiotensin converting enzyme, there is another enzyme being affected, which is kinase. Kinase is an enzyme in charge of breaking up an effective vasodilator, bradykinin. As the level of bradykinin decreases, vasoconstriction occurs. ACE inhibitors impede the effect of kinase. Resulting from this inhibition, the bradykinin is relatively increased. Higher concentration of bradykinin leads to vasodilation, which in turn causes both blood pressure and afterload to decrease. Before we move on, let's stop the presentation for 1 minute. On a piece of paper or using the notepad under, please brainstorm the following. What kind of diseases can we use ACE inhibitor for? And what adverse effects do we anticipate on patients using ACE inhibitors? We should brainstorm our answers based on the discussed therapeutic mechanism. The therapeutic category that ACE inhibitors belong to is antihypertensives. Therefore, it is primarily indicated for hypertension. However, it is also indicated for heart failure because it reduces both preload and afterload. ACE inhibitors are the drug of choice for patients with comorbid hypertension and heart failure. It is also the cardiovascular drug for diabetic patients because it has a protective effect on kidneys. Resulting from the inhibition on both RAS and kinase, the first adverse effect that comes to our mind naturally is associated with decreased blood pressure. Common side effects of ACE inhibitors are dry cough, hypotension, hyperkalemia, and rash, fever, altered taste. Major side effects are dry cough and angioedema. Both are symptoms of respiratory system. They are caused by the inhibition property of ACE inhibitors on kinase. The cough is dry, constant, and very irritating. Angioedema of the airway can be fatal due to airway obstruction. It approximately affects 0.1 to 0.2% of patients. As far as systematic adverse effects are concerned, dizziness and lightheadedness in the central nervous system result from low blood pressure. These are common symptoms for first-dose hypotension, which should be relieved after a few days. In cardiovascular system, hypotension, especially first-dose hypertension, manifests as lightheadedness and dizziness. A fatal cardiovascular adverse effect would be myocardial infarction. Adverse effects on the hematologic system are various blood dyscrasias. There are also minor GI and skin adverse effects. When it comes to nursing implications, we should stress on patient education because most of the time, patients take oral ACE inhibitors at home. They are their own primary nurses. Since ACE inhibitors change blood pressure, monitoring blood pressure and heart rate become essential. Patient education should also include signs and symptoms of, as well as management of, adverse effects. Hypotension is a common adverse effect, especially first-dose hypotension. Explain to the patient that this adverse effect usually disappears in a few days. To help preventing orthostatic hypotension, we should teach the patient to change position slowly from lying to sitting, from sitting to standing. Between position changing, allow 2 to 3 minutes transitional adaptation. Common remedy for GI irritation is frequent meals that are small in portion. Teach the client on preventing hyperkalemia by not using salt substitute unless consulted with physician or with physician's order. Encourage the client to follow up with the physician. Report to the physician if experiencing any adverse effects, and we should monitor patients' CBC and BNP. Patients should be taught to call 911 if experiencing any chest pain, shortness of breath, and difficulty breathing. These are symptoms for myocardial infarction and angioedema. Contraindications of ACE inhibitors include primarily pregnancy and lactation. ACE inhibitors are Category C and Category D under previous FDA labeling regulations. Its teratogenic effect prohibits usage in second and third trimester. ACE inhibitors are also contraindicated for nursing moms because it is excreted into breast milk. Of course, if the client has known allergy to ACE inhibitors, medications in this family should not be used. Other contraindications include existing high serum potassium level, children, and altered renal functions. The nursing care corresponding to the contraindications include teaching the client to report to the physician at once if being pregnant. The physician needs to discontinue ACE inhibitors and prescribe other appropriate antihypertensive. Also, with the patient's help, collect medication history on drug allergy. If the patient has any allergy reaction to ACE inhibitors, medications from this family cannot be used. Drug-to-drug interactions is another highlight for patient education. Here we have a list of medications that may cause undesired interactions when used together with ACE inhibitors. Generally speaking, when using with other antihypertensive medications such as renin inhibitors, angiotensin receptor blockers, and diuretics, the client will be put at higher risks for developing hypotension. It is understandable that when using ACE inhibitors with potassium-sparing diuretics, the risk for developing hyperkalemia would be higher. Lithium level can be increased, and lithium toxicity would be a concern when patients use lithium and ACE inhibitors together. NSAID can decrease the antihypertensive effects of ACE inhibitors. When taken with food, GI absorption of ACE inhibitors would be affected. In addition, ACE inhibitors could lead to hyperkalemia. When used salt substitutes, the client should be more careful. In order to prevent drug-to-drug or drug-to-food interactions, a thorough medication history should be collected. A complete list of medications indicating the medication's names, taking routes, dosages, frequencies, and last time administering the medication is beneficial for patient every time when she or he visit a doctor. The list is very useful for investigating any possible drug-to-drug interactions. Additional nursing care should include the following. ACE inhibitors can actually be taken with food. However, food in the stomach decreases the absorption of ACE inhibitors by 30%. Therefore, recommend the patient to take medication 1 hour before or 2 hours after the meal to promote absorption. Among all ACE inhibitors, there is this one ACE inhibitor that should be taken on an empty stomach at all times. This medication is Moaxipril. Teach the patient not to discontinue the medication even though that the blood pressure is normal. Normal blood pressure is the therapeutic goal. We rely on consistent medication concentration in the blood to maintain such goal. If medication is abruptly discontinued without medical management, rebound hypertension could occur. We are going to end this lecture with this list of ACE inhibitors. As we can see here that all ACE inhibitors end with the same name, pril. Enalapril is the only ACE inhibitor that is available in both oral and IV forms. Fosinapril is safe for patients with kidney problems. Both lisinopril and captopril are active medication, which does not need activation by liver like the rest of ACE inhibitors. The rest of the ACE inhibitors are known as prodrugs. ACE inhibitors can be taken with or without food. But when you take ACE inhibitor with food, absorption of the medication would be interfered and the effect could be compromised. Of all ACE inhibitors, Moaxipril should always be taken on an empty stomach. Thank you for spending time with me. I look forward to seeing you in the next lecture.